Hi, my name is Neka Okonkwo, and this is Journal One, reflecting on my weekly uh, clinicals in psychotherapy. I chose to become a mental health nurse practitioner because I've seen firsthand how powerful a supportive relationship can be. I'm also continually inspired by the strength people show when they are facing mental health challenges. Being part of someone's recovery journey is deeply meaningful to me. I'm also committed to reducing the misunderstanding and stigma surrounding mental illness, which so often influences how people are treated. I value that mental health care is holistic, focusing on the whole person by integrating biological, psychological, and social factors. My goal includes improving communication skills so I can build strong, trusting relationship with clients who have acute psychiatric symptoms. I also want to sharpen my assessment skills so I can notice subtle differences in mental health conditions while staying sensitive to cultural differences. On a personal level, I want to manage my own emotions better when working with challenging patients, keep healthy boundaries while showing empathy, and become more aware of my own reactions and any counter interference. I expect that my clinical thinking and interventions will change over the time. At first, my reflections may show gaps in my knowledge or uncertainty. Over time, I hope these will turn into a more confident and thoughtful decisions. I'm interested to see whether video journaling will highlight differences between my first impressions and how I later describe clinical situations, and whether it will reveal patterns in my practice that I have not noticed before. By reflecting regularly, I hope to be more mindful and intentional in the moment when I am with patients. I expect to face challenges such as unpredictable behaviors, ethical dilemmas, and staying therapeutic even when progress is slow. I may find it hard to work with patients who have limited insight or motivation, and I want to be careful not to push my own ideas of what is best over their autonomy. The emotional intensity of this work can lead to compassionate fatigue, and the system level issues like limited resources, short hospital stays, and fragmented care may also be discouraging. Overall, I want to be an empathic provider who understands how mental illness can change someone's mood, thoughts, and relationships. I hope to connect with what my patients are going through so I can support their recovery and stay present with them, even when their symptoms feel challenging or uncomfortable for me. Through this process, I want to grow into a more grounded and well-rounded clinician. This video journal will be structured tool for my professional growth. Each week, I will reflect on what I experienced, how I responded, what I learned, and how I changed. The first week will focus on what I already know, my motivations, my concerns, and my goals. Later entries will focus more on specific clinical experiences each week. By the end of the term, I hope to see a clear path from being a novice towards having more confidence and skill, especially in managing my emotional responses. Including a self-evaluation of my own thinking each week will help make sure this project stays helpful beyond this course and continues to build my reflective skills as a mental health nurse practitioner. Thank you.